All right. So to start our medical terminology section off, I do want to go over right here. I don't want to say to the left or to the right because I don't know how it's presented on your end, but I do want to go over this brown type of color, I guess I could say. And I want to first start off by saying, you may not know now because you're learning phlebotomy type of work, meaning collecting specimens from your patient. But the specimens that you're going to learn since we've been introduced to the auto draw, you know now that it may be multiple color blood tubes that your patient may need. Well, when it goes to the actual big lab, and when I keep saying big lab, I do want y'all to understand that if you work in an outpatient lab, like at a Quest or somewhere where the patient actually walked in, that's an outpatient. You don't result blood there. Someone comes and pick it up and take it to the big lab, which is pretty much Baptist in St. Elizabeth, in Nederland, the medical center. It's the hospitals that the labs go to, the blood work go to. Okay. So with that being said, unless it was a in-office procedure or a point of care testing that I'm going to talk about in a little bit, which y'all did one of them this weekend, which was a urinalysis dip. There are several tests that you can do in the lab to get results back quick. For example, the urinalysis dip. For example, a pregnancy test. People take that at home, right? You get the results back right then. So if you did a quick urine pregnancy test in the lab, that's also what can be resulted. A blood sugar test that we're going to do this weekend. Well, it's really a finger stick, but I have blood sugar machines. So that's why I'm saying blood sugar, because you get the result back within seconds. Also, a rapid COVID test. That means that once a person's throat or nasal area is swabbed for strep throat or COVID, those results come back quickly. So you will learn in due time that point of care testing you do in the lab. But any other test that required venipuncture, meaning the needle had to go through the patient's vein for you to collect the blood, all of that goes to the big lab. So with saying that, there is different departments in the lab that those specimens are going to go to. So I have 3 of them listed here because they are important. The first one, remember this is medical terminology, so it's my job to get you through the definition and the meaning. It is pronounced toxicology. First and foremost, if you ever see the suffix, and the suffix means the ending of a word that resembles, so you can already tell all 3 of these words that I'm about to explain have the same ending, and it is ology. So the first word, there is a toxicology department in the lab. What it means is the study of toxins. So when you see that word from now on, the suffix, the ending of this word, and it's ology, it means the study of whatever the root of the word is. So for example, toxic is the main word. It's considered the root. Ology is the ending of the word. So basically it means the study of toxins. What is toxins? We kind of use it sometimes in different terminology. Oh, he too toxic for her, or vice versa. Okay. So what it means is a person actually, it's too much for a person that can harm a person. So in this case, alcohol poisoning, drug poisoning, lead poisoning, anything that says poisoning is already giving us an insight that it was too much for the bloodstream, so it is toxic and it can harm the patient. So if the doctor orders like some of those tests, it will already give you an insight the more that you get experience that is going to the toxicology part of the lab. So what do I need you to remember? I just need you to remember it is a department in the lab, but I just need you to remember that toxicology means the study of toxins. And toxins is something that entered our bloodstream that can harm us because We had too much of it. Okay. The next medical terminology that we're going to go over is pronounced microbiology. There is a microbiology department in the lab. What does it mean? First off, okay, she just told us ology means the study of. So now I need to figure out what's the main word meaning. What is the root of the word? So if you remember when I went over the infection control earlier on, we talked about microorganisms. Microorganisms are like bacteria, funguses, parasites, viruses. Those are considered to be microorganisms. So microbiology means the study of microorganisms. There is someone that specialized and went to school that studied toxins. There is someone that specialized and went to school that studied microorganisms. So that is why that person is over that department. Okay, let me give you an example. Remember, we did a urine culture this weekend because my urine came back abnormal. You did a urine dip. It came back that it had protein and glucose in it. So because of it, we had to send it off to the lab. And we did send off a blood, not a blood tube, but a urine tube for urinalysis, the UA. And then we sent off the gray urine CNS tube, meaning culture and sensitivity. So let me tell you, any specimen that is a culture goes to the microbiology part of the lab. We learned this weekend that when the doctor orders a culture, no matter if it's with the urine, with the blood, with the poop, with the mucus, someone have a bad wound, like a sore, and that sore is leaking pus, the nurse will collect a wound culture. So anything that is a culture, it's going to go to the microbiology part of the lab because that is the department that studies microorganisms, and that is the department that does those cultures in order to tell the doctor what is the name of that bacteria living in that urine, that poop, that saliva, vice versa. And then remember, the sensitivity part of it tells the doctor what antibiotics will treat that particular bacteria that's laying or lying in that specimen. Okay. So microbiology, the study of microorganisms. It is a department in the lab where all cultures go. And when I say where all cultures go, I'm not saying just the urine culture and then the blood culture goes somewhere else. Nuh-uh. If it is a culture, no matter what bodily fluid, it all goes to the microbiology department. It may be someone like it could be Miss Robbie Lynn, Miss Lauren, and Miss Trinity. Y'all all work in the microbiology part of the lab, but maybe one is over the poop. Maybe one is over the blood. Maybe one is over the urine. But I just want you to know that no matter what, it's a culture, so it all goes to that department. Okay? Next, there is that word ology again. But what is the root word? What is the main word? And that's hematology. It is also a department within the lab. What does it mean? We already know it means the study of whatever the root word means. And that root word means blood. Oh, it's very important. Because as a phlebotomist, you're going to be dealing with blood a lot. So when you see the word HEMA or HEMO, it already means blood. In this case, it's hematology, so it means the study of blood. So that is a department within the lab. Okay. Now, for those of you that may have someone that go to a heart doctor, it may say, oh, we got to go to the cardiology department because cardio means heart. Ology, now means study, the study of. So for a person that has to go to the cardiology department, that means you're going to a specialist that specializes in studying the heart. Okay. So from now on, when you see those words, oh, that's and then somebody may tell you, oh, I got to go see a specialist. I got to go see a heart doctor. And you will know between, in no time, okay, that's the cardiologist. Okay. And remember the ending word, it cardiologist, just like phlebotomist, is the person that studies that profession every day. And that is your profession. So a doctor that specializes in the heart works in the cardiology department, but he does that all day. So it makes him a cardiologist. Okay. So hopefully that's understood. And with these three, I just need you to, I just need you to know the difference between the three and what they are. Okay. Toxicology, the study of toxins. So anything that the doctor feel that is toxic to our body and you have to draw the blood as the phlebotomist, it will go to the toxicology department. Okay. So if somebody thinks somebody had alcohol poisoning or drug overdose and they draw the blood for those levels, it's going to the toxicology department. Microbiology, again, any cultures for any bodily fluid, it goes to the microbiology department because that bacteria, if it's any bacteria, it has to grow, okay? And it grows in that department. And remember, cultures, it doesn't come back in the same day. It takes time for the bacteria to grow. So it takes up to 48 hours, which is equivalent to 2 days. So therefore, when you did that urine culture on me, and the urine already was abnormal when you dipped it. And remember, I explained the doctor did give me medication that day. But then 2 days later, the nurse called me and said, Miss Chopin, your results came back. We need to switch your antibiotics. Okay. That is the reason why they called back later, because it took up to 2 days for those results to come back. Okay. For any culture, ladies, it takes up to 48 hours. So it's not your job. So when you suck my urine off, or if you take a blood culture or any culture, you just let the patient know. They have to get in touch with the doctor's office for the results. It's not your duty to tell them it's going to take 2 days or 5 days. Okay. All right. Moving on. I need to go ahead and drink some water before I start choking. So the next words are I call my 4-H words. They're written in purple and the definition is in black. Give me one moment. These are important. I hate to keep saying that because everything is important. Everything on this you will see. It is medical terminology that you will see on my quizzes and on your big national exam. But I want to be able to explain it. You probably noticing these 4-H words that I'm mentioning that's in purple. Do you notice that they either start with H-E-M-O or H-E-M-A? So hopefully your brain has already figured out, oh, this has something to do with blood, because we just finished talking about hematology. And she said that anything in the root of that word means blood. Okay. So without further ado, all 4 of these words have something to do with blood. I want to break it down to you. So it has the pages next to it. So the first word is going to be on page 35. And it is pronounced hemostasis. Hemostasis. If you know what the suffix word means the ending of the word stasis, it means stop. That's the medical meaning of that word anyway. Stop. That's what stasis means. So because you already know that hemo means blood, oops, what does that whole word mean? Stop blood. Okay. So reading the definition accordingly, hemostasis is stopping the flow of blood. So what it is that when our body goes through injury and it causes bleeding, our body has a natural way of repairing itself. So because of it, it creates hemostasis. So for example, When you withdraw that needle, well, you pick up, okay, so you remove the tube, you pop the tourniquet, you pick up your gauze with your whichever your opposite hand, then you take the needle to withdraw the needle and you apply the gauze, and then you apply the safety, you tell the patient, okay, Miss Chopin, I need you to hold pressure for 3 to 5 minutes. Within that 3 to 5 minutes, ladies, after the 5 minutes and you lift up that gauze and there's no bleeding, that's because my body has created hemostasis, okay? So let's just say your child or someone slips and fall, or, cut themselves cutting up them onions for that gumbo. I'm always talking about food, but so let's just say you kind of prick yourself or whatever. You hold pressure, because the moral of the story is that if anyone is bleeding, in order to stop bleeding, you have to hold pressure. So when we're holding pressure, our body has a natural way of the bleeding to stop, and that is called hemostasis. For those of you that may go further in and go for nursing later, all of this stuff will come easy because it is included in those lectures. So hemostasis, stopping the flow of blood. You are doing that when the pressure is applied after withdrawing your needle for 3 to 5 minutes. So from now on this weekend, when we lift up the gauze, I'm gonna say, okay, make sure hemostasis has been applied. Make sure your patient has went into hemostasis, meaning stopping the flow of blood. In your book on page 35, just short and sweet, it says the root hemo means blood. The suffix stasis means slowing or stopping. So that means hemostasis is the stopping the flow of blood. Okay. I want to say easy peasy, but I want you to take time to just get to know it. And it'll come to you. But hemostasis, stopping blood. Okay. The next word, hematoma. We may have heard this before on Saturday when we were going over how to insert the needle and at what angle and all that good stuff. So hema means blood. Toma means a collection of blood in one spot. So in other words, it means a blood clot to us, okay? On 131, it talks about hematoma. It actually talks about hematoma in several pages of your book, but 131 basically lays it down pretty good, because chapter 9 is actually collecting blood. So it talks about it. So let me just tell you exactly, okay, well, what does hematoma mean? So hematoma is a collection of blood in the tissue, meaning a blood clot underneath the skin. It can create a bruise. So when we look at our patient, if a hematoma has been created, or let's just take it, a black eye, for example. That's what we call it. Somebody come in and you be like, God, where you get that black eye from? That's just the term we say. But it could be purple, it can be black, or, it can be blue. But what that means is it's blood collected underneath the tissue by the eye. And that's why on the side we see a bruise. But any bruise is nothing but a collection of blood in one spot. I don't care if it's on your knee, on your foot, on your elbow, on your arm. That's what that is, okay? Bruising is blood in the tissue inside. So a hematoma is a collection of blood in the tissue, aka blood clot. So what you need to know is how to prevent this, because this is not a normal routine to just give patients hematomas. Like, oh, you get a hematoma, you get a hematoma. So we want to do what we can to prevent hematomas. It is not you going to jail or fire if a patient collects a hematoma, no. But you do want to practice not having that happen. So I'm gonna give you some examples that's important to know. If the needle is not fully in the vein on insertion, you can cause a hematoma. So AKA, if the bevel is halfway in and halfway out, You may start seeing a little blood come in the tube, but it's not flowing fast like it should. And then you start looking at the site and it's starting to raise a little bit. Pop that tourniquet, take everything out, because you're not going to use that blood tube or anything because you didn't really collect enough. Each blood tube has to be full anyways on your patient. So I do not want you that if you start to see the skin starting to bruise or the skin starting to elevate a little bit, meaning because the blood is collecting and you see an elevation in the skin, just stop what you're doing. Pop the tourniquet, take out the needle, apply the safety, and apply pressure, because you can actually harm the patient more by continuing to draw blood when a developing hematoma is coming. Okay, that's example one for that. Example two, if you remove the needle before removing the tourniquet. So what it is that you remove the tourniquet, you remove the needle, the tourniquet is still in place. Not only is blood leaking, but there's no more needle for the blood not to come, so to speak. So once you remove the needle and the tourniquet is still applied, blood is leaking in the tissue and out of the site. So that's why it's very, very, very important to always be sure that you pop the tourniquet before removing the needle, okay? And you always take the tube out. If it is a successful blood draw and the blood is filled and you're using it to send to the lab, don't ever take that needle out with that tube still in there. Always take the tube out. That's why the directions is remove tube, remove tourniquet, and then remove needle, okay? Also, a third example that can create a hematoma is when you do apply that gauze, you're supposed to apply firm pressure. So you tell me, okay, Miss Chaplain, hold firm pressure or press hard or whatever you want to do to communicate to your patient to be sure they understand. Because guess what? If pressure is barely there to where the gauze is just kind of sitting on that spot, then the blood will be confused. Am I to come out or stay in? So a hematoma can develop from that because some of the blood could be leaking out, but also leaking in the tissue. So that's why it's very important to hold firm pressure so that blood can start creating hemostasis to stop bleeding, okay? So hematoma, a collection of blood in the tissue, which is known as a blood clot, okay? It can create a bruise. If the needle is not fully in the vein, a hematoma can be created. If you remove the needle before removing the tourniquet, a hematoma can be created. If you do not apply enough pressure at the site, a hematoma can be created, okay? The next H word is also dealing with blood because it starts with H-E-M-O. This word is pronounced hemolysis. Hemolysis. L-Y-S-I-S. What this means is that when you draw blood on everyone, okay, a component of our blood is red blood cells. It is highly needed for the medical laboratory technicians to result our blood. It's needed. If for any reason that red blood cell in that blood sample is destroyed, they can't result it. Okay. So hemolysis means that the red blood cells in that blood tube was destroyed. So you're probably like, oh, well, how was it destroyed? I just drew the blood. So an example is, and this is the main example that you're going to be tested on. The blood may not be able to be resulted, as I said. If you vigorously shake the tube, it can destroy the red blood cells in that tube. So for example, we briefly went over inversions. Inversions means you're basically in a figure 8 motion, gently bringing your tube from side to side. You're not going to bounce it up and down. You're not going to vigorously shake it. You're not going to mishandle that blood sample, because if that happens too many times for one sample, it will be destroyed. And you cannot tell per your visual eye. It's only able to be seen when the medical laboratory technicians look under the microscope and see that the red blood cells has been destroyed. So hemolysis is destruction of red blood cells. And if they can't result it, the result paper will come back with the word hemolyzed. It's the same thing, it's just past tense. It's been destroyed, okay? So hemolysis and hemolyzed is the same word, okay? I get it a lot. And matter of fact, at LifeShare in Beaumont, I think I mentioned it to y'all that one of my students came back with the least QNS samples, meaning quantity not sufficient. You don't want that, because if you get a bunch of those, that means they couldn't result it. So he came back with the least out of everybody for that particular month. He had the least number, which was good. So that means that all the blood samples that he drew, well, majority of his blood samples that were drew, he had the highest percentage that was able to be resulted because he had the least hemolyzed type samples, if that makes sense. So hemolyze is the destruction of red blood cells, and an example of destroying the red blood cells is vigorously shaking your blood tube. Okay. Our next H word, which is our last one, it is pronounced hemoconcentration. It talks about that on page 125, just like hemolyze. I forgot to mention the page hemolyze was on, but it talks about that, okay? Matter of fact, let me read the section about hemolysis that it states in your book real quick. It states, hemolysis is the destruction of red blood cells. If a tourniquet must be released due to excessive time before completing a venipuncture procedure, the phlebotomy technician must wait at least 2 minutes before reapplying a tourniquet to run the arm. But it also talks about vigorously shaking the tube or over working the tube. So that is also why what I mentioned a minute ago about the tourniquet, we need to be sure that it's not tied for too long, because even though the blood is flowing really well into your blood tube, by the time it gets to the medical laboratory, the red blood cells could have been destroyed. Hemoconcentration describes a buildup of blood cells in your blood tube, okay? So what that means, according to my whiteboard, it's an increased level of blood concentration in the tube. So let me tell y'all, you remember how I just said that the technique order is remove the tube, pop the tourniquet, and then remove the needle. If you remove the needle with your good sample of blood tube that's still attached inside the needle holder, when you remove it, it's going to make this noise like kind of like a fizz. And then when you do remove that blood tube from that needle holder and you look at your blood sample, it's going to be a bunch of bubbles at the top of the tube. That means that that tube has too much concentration in it. And guess what? If you were to send it to the lab, they're not going to be able to result it. So that's why it's very important to remove the tube, you know, before you remove the needle, because some people get excited, they pop the tourniquet and remove the needle while the tube was still in there. Now, let me tell you, what if it was the other way around and you did draw my blood, but you was not successful, and you tried to go up and you tried to back up and you still didn't get any blood? You pop the tourniquet, and in this case, it is okay to remove the needle with the tube still attached because you don't have blood to turn in anyway. It's the good sample that you do want to be sure that you remove the tube first, okay? If the tourniquet is tied in place for longer than 60 seconds, it can also cause your blood tube to have high concentration, okay? So sorry. So hemostasis, stopping the flow of blood. Hematoma, a collection of blood in the tissue, which is formerly known, well, not formerly known, but it is currently known as a blood clot. Hemolysis is red blood cells that's been destroyed in the tube. Hemoconcentration is a high concentration of blood in your blood tube, okay? And again, if any of this happened and the lab cannot result your patient, guess what? It's not the end of the world. Your patient not losing their life. You're not losing your job. The patient just have to be restuck again to get that sample, okay? But you do need to know the difference between the 4 of these and, you know, what it means that if it was to happen, okay? Just as explained the way that I have it typed out here. All right, moving right along. I want to go a little bit down here. And this is the area that I mentioned that I don't have to go into big detail for, which is talking about the arteries and the veins, because briefly in class, I did explain and you already pretty much been quizzed over the arteries and the veins. So just remember when we're dealing with blood drawing, we always draw from the vein, okay? We never draw from the arteries, okay? Remember, the arteries is oxygenated blood, and that's why that blood is bright red. Remember, the veins has no oxygen. It's oxygen depleted, no oxygen in that blood, and that's why it is blue in color. Looking at Our Lady right here, where you can see her veins and arteries, you can tell. So starting from our heart is the motor of the body. That's where the veins and arteries rejuvenate at. It's a big circulatory system. So yes, the veins has no oxygen, but it basically goes throughout the body and then goes to the heart, and then the arteries do the same thing. One is going away from the heart while the other one is going to the heart. The heart is where they gas up. The heart is where they rejuvenate, okay? So that's how our body runs. But as phlebotomists, you just know you draw from the veins, and the veins carry deoxygenated blood, and that's why they're typically blue. Remember, in some people, you can see the veins, but we want to get used to feeling and being confident where we felt the vein at, okay? All right. So let me go up here. All right, so I want to go here to my letters that I have written in black. First thing is first, I mentioned it just a while ago. It says POCT. That stands for point of care testing. It talks about point of care testing on page 23. So let me tell you something really quickly. Let me read the definition. Point of care testing meaning the test is done near or in the presence of the patient. You also get the result back rapidly, basically up to 15 minutes or so. For example, finger sticks for glucose testing for diabetics. When you actually do the finger stick with the blood sugar machine, those results come back like in 5 seconds. Pregnancy tests. According to the instructions, once a urine pregnancy test is done, it may take up to 5 to 10 minutes for the results to come back, all while your patient is waiting, okay? Rapid COVID test is also results come back. A strep throat test, a rapid flu. If it has rapid in there, we already know that that's coming back quick. meaning that it did not have to go to the big lab. It was resulted right there in your outpatient laboratory. And also, I don't have on here, but we did it this weekend, was the urinalysis dip. We did dip urine, and remember, it was a time test. So basically, it took no more than 2 minutes to read those results, 120 seconds, which is 2 minutes. So according to your book, it's the same difference. Point of care testing, meaning the test is done near or in the presence of your patient, okay? Just like the figure 2.3 on that same page of 23, they are doing a glucose test, okay? Tests with very little risk of error are known as clear wave tests. Phlebotomy technicians sometimes perform these tests, which are point of care tests. The only thing as a phlebotomist that you may not do is strep throat, okay? Because that is a nurse or a medical assistant swabbing someone's throat. You may not also do a flu test because that's swabbing someone's nasal cavity, okay? COVID test, there's many different ways, but if it's not collecting blood or directing the patient how to collect it themselves, you're not doing it, okay? But I may swab someone's throat and then bring it to you for processing so you can package it up so it can go to the main lab. You will see samples like that, but you wouldn't have to do those as phlebotomists, okay? So that's what point of care testing means. So if I ask you on this weekend, okay, what comes to mind when I tell you that I need a point of care test? Hopefully you can say, well, any test that we do that the results come back quick, okay? On a human, so to speak, you know, but any test that we do for our patients and we get the results back right then and there while the patient is still waiting, okay? Next, pre-analytical errors is how it's pronounced. It talks about it on page 105, but it's really just short and simple. The word pre means before. So if you have a pre-analytical error, basically it is saying that you made an error before the blood was even tested. For example, you misidentified your patient. You put the label on the wrong patient's blood. So before it even gotten to the lab, you all realize that an error has been made. So instead of sending it to the lab, you discard it because you know it's the wrong patient and you have to call the right patient in for them to get their blood drawn. Okay, so as it states in your book on page 105, errors that occur prior to testing a specimen are called pre-analytical errors. Careful phlebotomy technicians can avoid these errors most of the time. Misidentification of a patient or specimen is one of those most common errors in phlebotomy. It is also one of the most dangerous errors, okay? So most of the time, pre-analytical errors is called, it's named, it's an error before the test is even tested. So that means you caught it before it was tested. So either it didn't go to the lab or you all corrected something that was simple to correct before sending it to the lab. But definitely, if the wrong patient, you definitely have to redraw the right patient, okay? So I just want you to kind of just review that word and just know that it's an error that was created before the blood was even tested. So that means it's an error that can be fixed, or either you know ahead of time your patient has to be redrawn again. Next, fasting. We talked about this a few times. Fasting means nothing to eat or drink within a certain period of time, which is typically between 6 to 8 hours. Okay. Informed consent. We talked about this over the weekend. Informed consent and implied consent. They're both on page 24. Remember, informed consent is basically, it is for big procedures, but your quest may want you to do an informed consent, meaning that you explain to the patient what you're going to do and they have to sign a paper to acknowledge that they understand, or your question said we just get verbal consents expressed, like, do you understand, Ms. Chopin? Is it okay that I draw your blood? And I say, yes, it is. Okay. Remember, implied consents are used for emergency situations and non-verbal situations. We also should know what standard precautions is by now. Means that we wear gloves at all times because we assume that all bodily fluids are contaminated or contagious with any type of bacteria, which is AKA a germ, which all of that is a microorganism. Okay. Now, the last word in this section is pronounced palpate. So if you ever hear the word palpate, which in phlebotomy and in healthcare, you're going to hear that all the time. Palpate. That means to examine the body using your fingers or your hands. So in your case, as phlebotomists, remember, we always use our index finger, which is our pointer finger, to palpate for a vein. We are using our finger to feel for the vein. And that medical terminology means palpate. Okay. Now, moving a little bit down, I just want to briefly right here go over the protective equipment. We briefly went over that, and remember this weekend, I'm going to explain to you, like right now, we're practicing standard precautions. But what do you practice if it is known that a patient has an airborne precaution or a droplet precaution or a contact precaution? So I'll talk to you about that this weekend. But I just want to be sure that you know that personal protective equipment, which is abbreviations for PPE, it's not only your gloves, but it's also your mask, your gown, your goggles, or your face shield. And this is an example. Okay. You know how we put our sharp objects in the biohazard sharps container in class? It is red. And those sharp containers mean everything of sharps, any needles, any microscope slides. If you start working in the laboratory, that is sharp, that is glass. And it was also contaminated with blood. So that's why it's red and it goes in the sharps container. There is a such thing as a biohazard red trash bag. That means anything that was contaminated in blood that's not sharps goes in the trash, in the red trash. As you see here, you see this yellow trash, that it has the same logo, the biohazard logo. But what this means is linen going there. And when I mean linen, I mean your gowns, your sheets, because what if your patient actually had a type of precaution that anybody could catch from the sheets? It will not go in the regular laundry. It will go in the biohazard bag for infectious material, which is yellow. It's not sharps, it's not blood, but it is contaminated linen, and it goes in a yellow biohazard bag. All right. Next to it, without moving my cursor, I want to talk about, well, I want to move it because I do have some pictures to go with it. Let me make it a little smaller. All right, so I want to talk about my green sticky note here. So if you haven't taken a screenshot already, you know, maybe with me position it this way, you could take a screenshot. So I want to talk about this word, and it is in your book on page 34. It is pronounced syncope. Okay? It is pronounced syncope, Syncope. What does that word mean? You see my little lady right here on the floor, looks like she was exercising and probably all of a sudden she got lightheadedness. Syncope means that you're feeling like you're about to faint, or maybe you did faint. That is the medical terminology for syncope. So when you are working with a patient and then the patient say, oh, I fainted before, or they keep diagnosing me with syncopal episodes, that means that that patient just be fainting, have episodes of fainting all the time. So the word syncope meaning feeling faint or actually fainting. In your book, it talks about throughout a phlebotomy technician's training, he will learn medical terms for specific conditions. For example, the medical term for fainting is syncope. Straight like that, simple. You just have to be able to put syncope together with the word fainting. That's it. Okay. Moving right along, the next word, it's pronounced edema. 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 It talks about it on page 157. What is edema? You see off to the side on my whiteboard, you see a man's foot, or it could be a woman's foot, and it's swollen. And when you touch it, you can press down in it because of all that fluid that's in that person's foot. You all may have come across somebody or even yourself that may have had swelling. So the word edema is another name for swelling. So what it means is fluid in the tissue, which has caused your patient to have swelling. If your patient has swelling in his or her hand or in their arm some kind of way, do not draw blood from it. You can only imagine the moment that you, first off, it's going to be hard to palpate for the vein because it has so much swelling. Secondly, if you do make an attempt, the moment you insert that needle into the skin, fluid is going to come out the tissues and it's going to make it hard for you to even draw the blood. It will be mixed with the blood. So you do not draw blood from a patient who has edema. Okay. So the other word for edema is swelling. Okay. And your book even says if a patient has swelling in the hands, they are not a good candidate at all to draw a venipuncture, meaning insert the needle into their vein. Okay. Next, this word is pronounced petechiae. It talks about it on page 145, but you see the next picture on the side of it where there's a hand and it looks like white. It looks like a rashy area on their arm. I'm gonna mute you. It looks like a rashy area on their arm. Well, that particular medical term or condition is called petechiae. It means it's small red purple spots on the skin. I'm gonna tell you, if you ever see a patient with that drawing blood, it is not an emergency for you to stop, okay? I'm gonna read it from your book on page 145. Phlebotomy technicians should be aware that some patients may develop a rash-like condition known as petechiae after the tourniquet is applied. These small flat red or purple dots are created by the leaking of blood from capillaries. Petechiae may be associated with a number of different health conditions. Their appearance is not a cause for discontinuing the tourniquet use or stopping your venipuncture. So what it is that that patient could probably just be a little fragile. So when you tied the tourniquet, all of a sudden, you started seeing this particular rash light. It's not a rash, but remember, when you see red or purple or blue on someone's skins, basically that's blood underneath the skin. So I'm going to tell you, when we do our capillary sticks on Saturday, capillaries are smaller than veins and arteries, but they lie inside us. So what it is that when the tourniquet was tied on this patient, those capillaries probably broke off in little bitty pieces and just spread it in the skin. And that's why it looks like it's a rash, but it's not, okay? But what I need you to remember, that petechiae is small red purple spots on the skin, meaning the capillaries have broken up. Capillaries is another term for blood, but it's not the vein blood or it's not the artery blood, okay? Capillaries is in between arteries and veins in our body, and they're the smallest. So for example, you have to stick the arteries to get artery blood. You have to stick the veins to get vein blood. You also have to some kind of way puncture a skin to get capillary blood. So when we do the finger sticks this weekend, or if I use that example that you kind of pricked yourself cutting onions, cooking, if you fall and scrape your knee, that blood that automatically comes, it wasn't from a vein or artery, that's capillary. That means those are the smallest vein vessels that's just lying in our tissues, okay? Moving forward, we've talked about aseptic and antiseptic this weekend. Aseptic and antiseptic technique means to be free from bacteria or microorganisms. That's why we use 70% isopropyl alcohol, or we use chlorhexidine gluconate. Remember, chlorhexidine gluconate has several brands that we even seen in my classroom. One of the brands is ChloraPrep, okay? That's a brand of chlorhexidine gluconate. Remember, I don't have on here, but iodine is also a aseptic technique, but it's more for sterile type of techniques, okay? And you have to be sure that the patient isn't allergic. Next, ASAP or STAT means right now, as soon as possible, immediately. The reason why that is important in phlebotomy life is because some patients may be so sick that the doctors need their blood drawn stat, ASAP. So if you get an order that's like that, you may have 10 patients, but Miss Chopin in room 303, her orders are stat. You go to her first, okay? Let's just say you have those 10 patients. You have room 303, you have room 308, and you have room 315. All three of them is stat. Remember, it's not the end of the world. You just do them three first, one by one, whichever one you choose, okay? But remember, I'm teaching you the basic fundamentals. In real life, if you're working in a hospital and you get 3 stat orders, your supervisor may just send 2 other people to help you. You never know. But I'm just letting you know, if you get a stat orders, those are priority right now, okay? Next, on my green sticky note, I do want you to remember aseptic and antiseptic technique is cleaning the skin. But remember, if we talk about disinfectant means that you're cleaning some equipment or you cleaning surfaces. Those require a bleach and water type of mixture. So if you're cleaning handles, if you're cleaning cabinets, if you're cleaning the floor surfaces and things like that, the disinfectant solution for surfaces is always going to be bleach and water. They may slap a name brand on the bottle, but the ingredient is bleach. Chloramine is the medical term for bleach. I should have put this on here. Give me 1 second. Chloramine is another name for bleach. You can kind of see that it has Clorox, the beginning word of Clorox in there. But chloramine is another name for bleach and Clorox for the medical professionals. Okay. Any questions so far? All right, let me bring this down a little bit and show you. We haven't did capillary sticks yet, which we'll do that this weekend. It's going to be simple. It really is. We just need to know what fingers to stick, what area of the fingers to stick, and how to place the lancet needle. But what I need you to know, like right here in this dark green, it says capillary. I mean, dark gray. It says capillary, the smallest blood vessels that contain both venous blood and arterial blood. Okay. So every time we do a capillary stick in real life, you may have to do a capillary stick to check someone's iron level before they donate their blood or plasma. That's why we go over the capillary sticks. But right here in this pink image, you see one side is the vein and it's blue. Another side is the artery and it's red, but in between is the capillaries. They're really small and stringy-like, but it's a combination of vein and artery blood together. So when we stick someone's finger and get that little drop of blood, that's called capillary blood, which is a mixture of vein and arteries together. Vein and artery blood, sorry. Okay. Now I want to go over one more thing. It's 2 sticky notes at the top that I'm not going to go over today. I'm gonna go over Thursday. Let me just tell you for those that already screenshotted it. So these 2 yellow sticky notes, I'm gonna start Thursday Zoom with that. Okay. But I want to go over down here. You probably saw the pictures. Where's the lady sitting and laying and all that good stuff. Okay. So as a phlebotomist, you do need to know certain positions because your patient may faint. Your patient, hopefully, you don't have to go through that, in a long time, hopefully never, but you may have to provide CPR to your patient, okay? So what I want you to do is visualize these positions, and it's not many, not all of them. It's just that that's the only image I'm showing. But in this pink sticky note, you see how it says dorsal and I have back. Remember we talked about dorsal metacarpal for the hands. Remember that means the back of the hands. That's what dorsal means. So I just want to be sure that you remember what dorsal means. Now also remember supine. I'm gonna explain it to you in just a minute, but I want you to remember supine, prone, lateral, and Fowler's. Okay, so let me go ahead and go to my position. So you see this lady here, she's lying in different positions. If your patient needs CPR, or if your patient says he or she has to lay down because they feel dizzy, you're never going to lie your patient on their stomach. You're always going to lie your patient on their back. So what that means is you need to know that your patient needs to be in a supine position. I had one of my students, just like how Alicia kind of told us about the triplets, that's how she's going to remember her serum tubes. I had a patient that tell me how she remembers supine is that she think about a bowl and you eat soup out of a bowl, and the area of the opening of the bowl is up. So she said that's how she remembers supine. Okay. I don't know if that makes any sense to you or if you want to remember that, but I need you to know as a phlebotomist, if your patient starts to faint, do a syncopal episode, syncope. Y'all have to get your patient to the floor and he or she has to be in a supine position. Now, if your patient was lying on their stomach, it's considered to be a prone position. You would never, ever, in no situation ever, lay your patient in a prone position. I just need you to know the difference between the two, because if it's given to you in the question, I need you to be able to select the correct answer. Okay, so prone position is lying face down versus supine position is lying on your back. It's very important as a phlebotomist that you know supine. And I'm throwing in prone because you need to know the difference, because I don't want you to pick supine as a patient lying on their back. I mean, I don't want you to pick prone to represent the patient lying on their back, because the answer will be supine. Okay. Now, you see the lady right here, she's lying either on her right or on her left. I don't need you to concentrate on that R word comment as far as the type of lying she's doing. I just need you to know what the word lateral means. So hopefully when you put together right lateral, left lateral, hopefully you know that lateral means side. So if I was to ask you, okay, you know, Ms. Robelin, what does lateral mean? Hopefully you can tell me side. Because in the medical field, the doctor, the nurse, or your supervisor may say, oh, when Ms. Chopin come in, she has to be right lateral, like lay right lateral. So that means that lay on her right side. So I need you to know lateral means side. I need you to know supine means laying down on your back. Prone means laying down on your stomach. We're not going to worry about Trendelenburg. That's just a picture that's on here. Doctors in the hospital get patients to lie like this in the hospital bed because you know it's an operated bed. So for a patient that has high pressure in their brain, a doctor may tell the nurse that the patient has to lie Trendelenburg for a certain amount of time in the day. It will not have to do with nothing about your job as a phlebotomist, but I would tell you, once you start working in a hospital, if your patient is lying like this in the bed, then you simply just walk back out and find the nurse and ask the nurse, is it okay for you to lay the patient correctly, you know, so you can draw their blood, or do you need to come back? And then, you know, the hospital beds are battery operated. So, you know, in some words, you can lay the head up. And in this case, it's like it's going backwards. And all hospital beds do that. Okay. But you don't have to worry about Trendelenburg at all. You know, don't even write it down if it's going to confuse you, because it's not what, you know, you don't need to know. But Fowler's position, just imagine sitting in a recliner or sitting in the bed with your head all the way up. That's a Fowler's position. So just think of a Fowler's position as sitting down, just reclined a little bit. So you may work in a lab that has a reclining chair for your patient if they get nauseous and they need to just be in a reclining position. That's considered a Fowler's position. I've been told by my patients that a lot of them do not get this question. I guess it's only maybe on 1 or 2 versions that it doesn't, they have not been getting the question about Fowler's, but it would not be right if I just still don't tell you, because you'll look up and get that question, okay? So just remember that Fowler's is a sitting position, basically reclined a little bit, okay? So prone, supine, lateral, Fowler's, and dorsal. Dorsal means back. Any questions, ladies? I know it was a lot. I tried to prepare you that it was going to take about an hour to explain everything. But this is the medical terminology section that you will see again on your big national exam. And I'm going to quiz you on it tomorrow. Hopefully you took notes, and hopefully, you know, I explained well that some of it probably already sunk in. I will put it in questionnaire form, though. I wouldn't just say, okay, what's another terminology for fainting? I want to kind of It'll be in a detailed way, but I want to just still get you geared for how the questions you're going to see later. And remember, excuse me, remember when I'm releasing those results back to you, not only should you go over what you missed, but keep them. Don't delete that. Even if you deleted the other quiz with the blank quiz, the blank one, keep the one, because basically you're going to have two emails from me. One with the original blank quiz, and then one when I send it back to you with the results. So just try to keep those, the one with the results, because they're going to be good study tools for you at the end. Okay. And the more that you get quizzed, the longer my questions are, and the more formal. Well, the more questions you're going to get, and the more formal the questions are going to be in more testing style. Okay. All right. I have a video that I'm not going to show right now. I don't want to make y'all scared. I thought you said we was done. But I do have